Good afternoon, everyone. Myself, Dr. Ravi Kukreja, MD Medicine, consultant physician and intensivist from Jalgaon. Today, our topic of discussion is chronic kidney disease, that is CKD. So generally, first clinical presentation which we will discuss today is pedal edema, that is swelling of both feet, including the ankle area. The main reason for this pedal edema is due to fluid extravasation from the lower limb vessels, which is a sign of, you can say, blood vessel leakage or increase in permeability, causing pedal edema. So, yeah, there are many reasons of chronic kidney disease, which a physician has to first diagnose the condition. This chronic kidney disease may be due to any chronic illness like hypertension, diabetes, or any mechanical obstruction in the path of the kidneys, like urinary tract obstruction, that is obstructive uropathy, or any renal calculi. Also, there are other less common causes of chronic kidney disease, like autoimmune diseases, connective tissue disorders, like SLE, systemic lupus erythematosus, and kidney injury can also be related to chronic drug abuse. So a clinician has to take a proper history, which is the exact reason of this chronic kidney disease. Also, the clinical examination of the patient, like pulse, blood pressure, respiratory rate, and swelling in other regions of the body, like periorbital edema or increased jugular venous pulse pressure. This is also to be documented, and the treatment plan will be decided according to these clinical features. Chronic kidney disease, basically, when the kidney function reduces or the functioning of the kidney decreases, there is proteinuria in the urine, which will be detected by the early morning urinary samples. If there is significant proteinuria, or also there are RBC cells cast, like RBC or other cells cast, that will point to the specificity of the disease. So the treatment management for patient with CKD depends on many parameters as discussed. First, these patients require optimum blood pressure control. It should be around 130 systolic to around 80 diastolic pressure. It should not be above 135 systolic. So the drugs which are commonly used are calcium channel blockers in these cases, and diuretics like loop diuretics, basically furosemide and bumetanide. Other drugs which are used for blood pressure control in CKD are alpha agonists, that is clonidine, arcamine. Also, drugs like prazosin, which are also considered safe in chronic kidney disease. Other points clinician should see to it that drugs which are contraindicated in kidney disease should be avoided, like drugs like Ramipril, 81 antagonist, that is telmisartan, losartan. These are to be avoided if the creatinine is level is more than 1.8. Also, considering chronic kidney disease, if the creatinine levels are more than 2.5, and if the patient is in fluid overload, then fluid restriction is also monitored and advised to the patient. Some patients require the cases with CKD stage 4 or CKD stage 5, even fluid restriction up to 800 to 1000 ml per day is advised in some occasions. CKD patients, since are proteinuric most of the times, they require frequent monitoring, plus comorbidities should be under control, like sugar, BP, and if there is underlying coronary artery disease, also antiplatelets has to be started just to prevent any cardiovascular catastrophic event. Thank you everyone for the short speech on CKD and pedal edema.